Okay, today we're going to be doing a little scenario where a patient is coming back following a breast biopsy a week ago. The breast biopsy shows a diagnosis of cancer, and as the nurse, I'm not aware whether the family physician has spoken with his patient to give the diagnosis or not, so I may indeed be telling her the bad news. Not all bad news is given by nurses. It may be the physician is the primary deliverer of this news, but in any situation, the nurse is usually there to follow up the bad news story and to help the patient through it. Make sure when you're working that you check the facility that you're in for what is the best practice policy in giving diagnosis to patients. Hi, are you Mary?
I'm Mary.
Come on in, have a seat.
Oh, okay.
Hi.
Hi.
My name's Betty, and I'm the nurse working in the clinic today.
Hi, Betty.
And what's your name?
Oh, well, it's Mary S. Smith. Kind of a
Okay.
common name. That's why
Yeah.
I'm throwing the S.
Yes, well, yeah, Smith is pretty
That's
common.
Add the S.
Okay, that's a good idea. What's your birth date?
Oh, June the 10th, 1955.
Okay, thanks. And the reason I'm asking that is I just want to make sure that you're the correct patient.
That's a very good idea.
Yeah. So, Mary, can you tell me why you're here today?
Oh, well, I had a breast biopsy a week ago. So, well, you knew that, right?
Yes, I do. I do know that. I'm just wanting to see what your expectation for being here today is. Did you speak with your family doctor before coming today?
Well, I didn't, because he's on vacation.
Okay.
So I haven't had a chance. But do you have some information?
I do. Yes, I do. But I just wanted to see if he had spoken with you
No,
and had
not
given
yet.
you any information at all
Not yet.
before I'm going to talk to you. Okay, let me just get my information here. And let's just move a little closer together. I'll just put this here for you. I have this paper with me right here.
This is the
And
pathology report?
This is the pathology report from your biopsy that you had. And there's a lot of words.
What does it mean?
Well, let's go down to the very bottom part here where it gives you the diagnosis. It says that you do have a breast cancer. See that part here? A breast carcinoma cancer. Were you expecting that?
Well, I knew there was a possibility. I was hoping that wasn't the case.
You were hoping, yeah. So you weren't planning for this in your mind today? No. Okay. Well, unfortunately, this is what it's saying. The plan today is, first of all, to inform you and then to help you along the path that this diagnosis has given you. So, before I do any more, the doctor would like to see you and examine you and explain some of the options that are available for you. This requires surgery, and so a surgical intervention is likely what's required, and so I would like that explanation. Is there anyone with you here today to help to come in and listen?
No, I'm by myself. My husband is out of town for a bit.
So this is going to be your report, and what my job today is just going to help you understand what this means and what the next steps for you are going to be. You have to also see today a surgeon who's going to come and examine you and also, right away, and explain some surgical options to you. There's choices that you can make, and so that's the job of us, is to help you understand what those options are and how, whatever choice you make is good with us, and you have to make those decisions. So the next step, you doing okay for now?
I think so.
Yeah, okay. The next step then will be to leave you for a few minutes. I'm going to get you to change your clothes for the examination. So your top clothes off and have the gown open to the front. You can leave on your bottom clothes.
Okay.
And then the doctor will be in. And after that, you can change back to your shirt, everything, all your street clothes, and I'll come and talk to you. Okay?
Okay.
Okay, good. Hi, I'm back. How was that little scenario with the doctor? Did you get some of your questions answered?
Yeah.
Yeah.
It's all very overwhelming.
Oh, I know. This is not the news that you wanted to have today. I know that. Just take some time. This is difficult, I know. And do you have anyone at home or near you? I know your husband's away that can be helpful to you, give you some support?
Yeah.
Yeah?
Yeah.
So you're not alone?
No, he'll be back tomorrow, and my sister lives a block away.
Okay, so the doctor talked to you, and he gave you some options. Did you make a decision about what you thought you might want to go through with for surgery?
Well, I think I might go with a lumpectomy.
A lumpectomy, yeah. A lumpectomy.
But I don't know. I don't know. I'll have to think about it.
Okay, so your thinking is still in. So that's okay. You can go home and decide later and phone and tell the doctor what you want.
Yeah, I can't think very much
You
right
can't.
now.
Yeah, okay. Yeah, I understand that. So I'm going to give you some information that'll cover both types of this options, surgery for a lumpectomy or surgery for a mastectomy.
Okay.
And that maybe will help you. Okay? So let me get all that stuff ready. It's quite a lot of paper. And as you see, it's quite a little pile. I'm just going to explain some of it to you so you know why I'm getting it to you. This just is a journal that is complimentary from somebody to keep track of things like an appointment time or keep track of little papers.
That's handy.
Yeah. Some people like it and some people don't. They don't want to use it. But if you want to use it, it's good. Same with this whole information package I'm giving you. If you find it's too overwhelming and you don't want to deal with it, that's your decision. But it's here that if you need information, it's available to you.
That's very good.
You mentioned that you weren't sure, and right on top today, when I pull out the papers, is this guideline, the Clinical Practice Guidelines for the Care and Treatment of Breast Cancer from the Canadian Medical Association.
Oh, good.
So,
that looks like a good source.
Yeah, so it's helping you choose the most appropriate operation.
Oh, I don't have to decide by myself.
No, well, you do. You have to decide, but we hopefully with the information you can make an informed decision and know what you're deciding about. Okay, so it asks the questions. What is a mastectomy? What is a lumpectomy? How do I choose between the two? Advantages, disadvantages. So it goes through all of these various questions that someone has thought would be good questions and the answers to the questions. And it asks quite a few questions about many things related to the surgery. And then besides that, there's the guidelines for radiation, because if you have a lumpectomy, you usually require radiation. And that's something that someone would need to know that, yeah. If you have a mastectomy, you might not need any other treatment. But so those are the important pieces of information you need to know before making a decision.
I'll just put it over here,
Okay,
okay?
yeah,
I
that's
really
fine.
want to look at it.
Okay. It says that you have invasive ductal carcinoma, and that's a cancer that starts in the milk duct and grows into the normal breast tissue.
Okay.
It's the most common type of breast cancer.
Oh.
So there's many women that would have this as well. Like when you're talking to people about their breast cancer.
It's the most common. Is there good treatment then? There must be. If it
There
comes
is
up.
treatment, yeah.